exhausted but relieved. Their nightmare is at an end. Last week, these residents were pulled from their beds in the middle of the night after 2 people living floors apart tested positive for COVID-19. It sparked fears the virus could be travelling through the pipes, gripping Hong Kong with a collective dread that it was about to watch history repeat itself. This is Amoy Gardens. In 2003, it became synonymous with tragedy. 42 residents lost their lives to the SARS epidemic. Hundreds more were infected. Defective pipes had been carrying the virus directly into people's homes.
The whole Amoy Garden become the ghost city. No people are there to come to the Amoy Garden. I feel so sad and so helpless. Even though after 7 years, the image are still becoming to my mind.
The horror of what happened here is still seared in people's minds, many still haunted by the scale of the tragedy. And it's that which is now fueling fears today.
Mr. Yip says lessons have been learned and additional hygiene measures introduced, but that's done little to calm nerves. With masks and hand sanitizer both in short supply, toilet roll is now the latest target of panicked shoppers. Concern so great, one online rumour of a shortage was all it took to empty the shelves.
I think the reaction of the Hong Kong people is actually justified. How would they know who would infect them? I can be talking with a friend who appears to be absolutely asymptomatic, and then I may be infected and I may die.
Professor Lai treated SARS victims. He sees echoes of past mistakes and thinks more must be done to prevent another devastating outbreak.
History is repeating itself already. I think at least the least the Hong Kong authorities should do is to encourage everyone, every single one, to wear masks and also supply adequate equipment for the medical staff to actually protect themselves.
For SARS victims, this outbreak is particularly painful. Alex Lam leads a network of survivors. While they're bracing for the worst, he says SARS is proof that Hong Kong can come back from the brink.
Back in 2003, we spent 4 to 5 months' time to fight against the disease. This time, we may have a longer time to fight, and we should not be led by the fear inside us. Even though we have the past experience that we should be telling everyone, here we are. We came across the most difficult time in life, but we are standing here.
Back at Hong Mei House, authorities have given residents the all clear. But caution here was born from experience. Given Hong Kong's past, the spread of fear can be as challenging to contain as the virus itself.
Another doctor in China has died after contracting the new coronavirus in Wuhan, the epicenter of the outbreak. The doctor's death comes as health officials in China publish details of a study into 70,000 cases of the virus. The report suggests that the number of new infections is falling. So far, the virus has killed just over 2% of those infected, with older people and those with existing conditions more likely to die. But Beijing warns that could change when people start returning to daily life. For more, let's get to our correspondent, Matthias Bollinger, who is standing by in Beijing. So, Matthias, according to this study, the number of new infections is declining. Does this mean that the worst is over?
The report indeed strikes an optimistic tone, saying that the number of new infections is not rising at the same pace as it was. But if we look at the data more closely, the data is up to the 11th of February. Now, 2 days after this date, we had a massive increase in new infections that was caused by a change in counting, by including probable cases that have not yet been confirmed into the statistics. That day the number rose by 15,000 in Hubei province, and then the next day again 5,000. Part of these probable cases are included in this study, but not all of them. So all of this has to be taken with caution. What is true is that we don't see this pattern of increase in other provinces outside of Hubei, but it's still too early to make a prediction.
Matthias, who's been most impacted by the virus?
impacted by the virus are mostly people over 30 to 79, adults. Some scholars have already remarked that this remarkable finding that few children seem to be affected. For the death fatalities, we can say that mostly elderly people with most fatalities, proportionately most fatalities in the age group above 70 and above 60. This is not a surprise. This is what doctors have been saying before. And of course, by those who are affected by infections, the number of medical workers is quite remarkable. 3,000 medical workers infected or suspected of infection so far.
You mentioned some numbers there. How does this outbreak compare with previous virus outbreaks like SARS, for example?
Well, I think the main difference to SARS and MERS, that is another similar virus, is that it spreads much faster. It's much more contagious than SARS. The death toll, the fatality rate is lower, therefore. So it's spreading faster, but it is less deadly than SARS.
Matthias Bollinger joining us from Beijing. Thank you.